Good morning, everybody. How's everybody doing today? Are you liking this fresher weather? Isn't that great? And I do welcome you to be here today. I am president and founder of MS Views and News. This is officially our 11th MS Symposium. Isn't that great? 11 years we've been doing this. So, I wanted to thank our sponsors of today's program. All right, we have a lot of sponsors today. I'm sure that you made it through our resource room. We have our platinum sponsor is Celgene. We have bronze sponsors of Memorial Healthcare System, Sanofi Genzyme, Novartis and Genentech. We have our community sponsors of Mallinckrodt and Curaleaf, and we have our educational supporter is Biogen. And I hope that you can all give them a round of applause because they deserve it. All right, in addition to them, we have, well, I want to thank all of you for attending, all right? So my thanks to all of you for being here. Thank you very much. We also want to give thanks, please, to our volunteers, all right? My family. We have a lot of family here today that are helping out, all right? And again, the MS Views and News staff. Of course, we should give everybody a round of applause, all right? Thank you. Thank you. Our next speaker is a local psychologist. His name is Rick Harris. Dr. Harris was awarded his Doctor of Psychology from Nova Southeastern University in 1982. Throughout his 30 years of experience in the mental health field, he has worked in inpatient, outpatient settings with children, adolescents, adults, and seniors. From the beginning of his career, he has been interested in the mind-body connection. As a consultant to the National Healthcare Company, he developed behavioral medicine programs for cancer, cardiac, GI, and primary care patients. As the executive director of the Neuroscience Center, he was involved in research in the brain-behavior relationship. He has taught at the doctoral level and continues to train psychology residents. He's presently in private practice in Weston, Florida. Let's welcome Dr. Rick Harris. Thank you.
First of all, I want to thank you all for being here, and thanks, Stuart, for MS Views and News to have this symposium. I'm excited to talk about my topic. I know it says MS and relationships. We'll touch on that a little bit, but I also think it's important that we talk about the psychological impact of MS. And so often, as we know, we don't talk about the psychological impact or the psychological issues associated with MS. So I'm happy to have this opportunity to share that with you, and hopefully when you leave a little bit today, you'll know a little bit more about what's going on. So how many of you all, if you don't mind, have been recently diagnosed within the last year and a half, 2 years? Can I see a show of hands? Okay, just a couple of you. So certainly we know, there we go. Certainly we know that obviously the diagnosis of MS can have an incredible impact on our psychological well-being. So what I'm going to talk a little bit this morning is the impact of diagnosis, depression, anxiety, fatigue, and a little bit about the psychosocial factors involved in MS. But most importantly, I'm hoping that you leave today with some things that you can do to help manage the psychological impact. That's my goal today. It's not just about educating, but it's also what is it we can do to help ameliorate or help deal with the psychological impact. Certainly, we know that the recent diagnosis of MS can have a profound effect upon us. How we deal with that diagnosis is going to really determine how we cope with the ongoing symptoms of the disease. It's not uncommon for people to have feelings of shock, denial, fear, confusion, some feelings of abandonment, isolation, relief, and in some ways, some people report relief or happiness because they finally know what's going on with them and they know what they need to do about. So it almost gives some people a sense of control. We all have a different response at the diagnosis. We come to this diagnosis with our own personality, our own coping skills. We're not unique. We're unique in the sense that we have the different ways we deal with things in life. The thing we have in common is that we've been diagnosed with MS. And there are very different responses depending upon the demand placed on you. There's no one way, there's no right or wrong way to deal with this diagnosis. We need to take a look at our own strengths, our own weaknesses. It can cause some conflict, and it can cause some communication response. When we started to take a look at how people cope, not only with the disease, but how they coped with that diagnosis, we were able to look at two different ways of coping style. One we called emotionally reactive, and the other was problem focused. What we saw with the emotional reactive had more negative cognitions, negative thoughts about the disease. The problem solver thought about what they could do, how we can handle this. And when you look at those two different ways of coping or dealing with the disease, we certainly know that the problem-focused coping style is the one that leads to improved quality of life and less impact psychologically on us. I once heard this metaphor that in some ways MS is like the uninvited guest. We've all had this experience. We get that call from a relative, especially living in South Florida. And we're going to get those calls really soon because the weather is really cold up north. I'm coming down and I'm staying with you. And we know, and sometimes those people come down and they overstay their welcome. Well, MS is very similar to that. It's chronic, it's intrusive, it's unpredictable, it's expensive, it causes us emotional consequences, it's draining and challenging, and it disrupts our daily life. It's also not uncommon for us to have feelings of loss or grief. How many of you, when you were first diagnosed, felt like you were lost something or that you were grieving? That's a real common reaction. But why? Why do we experience grief? It is adaptive. It's a common reaction. It's adaptive. It allows us to survive change. It helps us to find new and creative ways to deal with change. In MS, it can be a tool to help us reevaluate life, revising a view of life, change life where needed. I was involved in a study down at University of Miami where we looked at people who were diagnosed with cancer. And our hypothesis was that it would be a traumatic event for almost everyone. And what we found was there was a group of people that didn't experience it as a traumatic event. They dealt with it. As a matter of fact, it was an opportunity for them to reevaluate their life, prioritize their life, and change their lifestyle. So the diagnosis of a chronic medical problem does not have to be a traumatic event. It could be an opportunity to reevaluate life and to move on. Grief is a positive response to loss. It's overwhelming, but it allows you to go on. And there's this a wonderful saying, And I'm going to talk a little bit about this later. Yesterday is past, tomorrow is future, but today is a gift. That's why it's called the present. And we're going to talk a little bit about how we stay in the present. And I'm going to share with you a technique that I use to help us be here now, so to speak. Elizabeth Kubler-Ross, about 15 years ago, defined this process. And it's not uncommon for us at first to be in denial. This isn't happening to me. It's not uncommon for us to get angry. Why me? I ate well, I'm healthy, I got good karma, I give back to the world. Why? What happened? Why do I deserve this? Then we start bargaining. I volunteer. I'll give back. But please, not me. And then we might get depressed, giving up, feeling as if this is too overwhelming to deal with. And the last stage of grief is acceptance. And that comes from, I'm ready to deal with this. Whatever comes, I can deal with. Now, this process of grief doesn't necessarily come in this order. But what's important, kind of do a little introspection. Get an idea where you're at in this particular process, because you can change it. And we'll talk a little bit later how to change it. You know, I'm aware that, interesting enough, in the Jewish religion, when people lose a loved one, they sit Shiva. And the purpose of Shiva is to grieve. And everything that's done in that process is to exaggerate the grief. In a traditional Shiva house, people cover their mirrors. Why? They don't want to ever remember themselves grieving. They sit on Shiva stools to exaggerate that loss, to exaggerate that uncomfortable feeling. Family comes over and brings them food, not to have a party, but so that family or that member of that family does not have to think about sustenance. The whole purpose, a circumscribed period of grief. Once it's over, people celebrate life. And so what I'm saying to you is, if you go through this process of grief, allow yourself to grieve and then celebrate your life, even with whatever limitations you might have. So common when we're diagnosed, we have a chronic illness, we look at what we don't have. And that's not a real good attitude. A better way to look at it is, what do I have? What can I do? Not what I can't do. So often we see people with experience MS have a mood disorder. What is a mood disorder? The mood disorder is defined as a sustained and pervasive emotion that influences our perception of self, others, and the world, such as depression and anxiety. When we look at MS, the focus has really been on depression. However, more recently, we're starting to recognize that anxiety is also a psychological effect of MS. So often I'm asked in my practice, what is depression? So often we ask, am I sad? Is it depression? When does it rise to the level of being a clinical depression? Certainly sadness does not mean, we all get sad. But when does it rise to the occasion that it's important to do something about it? So these are some of the symptoms I want you to take a look and understand. If these symptoms occur over a period of time, over more than 2 weeks, and are starting to affect our quality of life, then it's time to do something. Obviously, depressed mood, diminished interest, weight loss or weight gain. It's important to understand that we used to think with depression that people would lose their appetite. We also see that people have what we call carbo cravings, and they crave foods and they can gain weight. Insomnia, an inability to stay asleep, or also an inability and a desire to sleep more. Feeling of agitation, or feeling as if your body is leaden and you can't move. Fatigue. Very, very common. Feelings of worthlessness or guilt, diminished ability to think, and recurrent thoughts of death. What's important to understand, the prevalence rates of depression in MS are between 25 to 54%. The most recent research indicates 50%. Think about that. 1 out of every 2 of you all will most likely experience a significant period of depression. Okay? I'm not saying this to scare you or to alarm you, but to let you know it's treatable. We know that there are higher rates of depression with MS when we compare it to other chronic illnesses, including neurological disorders. The incidence of depression is significantly higher. And we also know it's often unrecognized. And that's what, as Dr. Stango said, you need to talk with your physician about these symptoms as well as your physical symptoms. So we talk, what are the causes of depression? So certainly we talked about the diagnosis, the loss, your reaction, relapses can cause depression, changes in brain functioning, and medication side effects. But what's important to understand that there are 21 symptoms of depression. We know that 13 of them are associated with a biological problem, which may require medication. And we'll talk about that in a little bit. Anxiety. Anxiety is, first of all, when we stop to understand anxiety, anxiety is a normal part of our life. I was standing back there, I don't know if you had a chance, I'm pacing. I'm walking back and forth. I'm a little anxious about coming here and speaking to 200 people. That's a normal reaction. Anxiety is a perceived threat. Okay? Fear is an actual threat to us. So when I'm standing back there and I'm doing my little pacing and nervousness, I'm concerned. Y'all might not like me. I might not do a good job. You're a perceived threat. Just kidding. But that's what anxiety is about. And that's the difference between anxiety and fear. So anxiety is a normal reaction to a perceived threat. When that anxiety starts to be more chronic and over a longer period of time, it becomes an anxiety disorder. And what are those symptoms? Worry. Excessive worrying. We all worry, but excessive worrying. And it has to be over a period for 6 months. The worry is experienced is very challenging to control. It's almost as if, excuse me, we can't control it. We become obsessed with the worry. The anxiety or worry are associated with at least 3 of the following symptoms: feelings of edginess, restlessness, more fatigue than usual, impaired concentration, irritability, increased muscle tension, difficulty sleeping, restlessness, And the anxiety, worry symptoms, affects our quality of life. These symptoms are unrelated to any other medical condition, and these symptoms are not better explained by a different mental disorder. So anxiety is perceived fear when it's chronic and starts to affect how we live our life. It's important to do something about it. And there's different types of anxiety. People can experience anxiety attacks or panic attacks. Certainly we know that another psychological effect of MS is fatigue. 80% of all MS patients will experience severe fatigue. All of you will experience some point in your life or during the course of the illness will experience fatigue. Let's talk about treatment. Okay, MS patients are not adequately treated for depression. There's a lack of service, a lack of understanding. What's important to understand is for depression, medication may be indicated. And I'm happy to tell you today that we do things very differently than when I first entered the field. It's important to get an accurate evaluation. If you identify with any of those symptoms that we talked about earlier, it's important to get an assessment. The purpose of the assessment is to see if there's an intervention that can be done. Certainly medication may be appropriate. That's where I talked about the 13 symptoms are an indication that medication may be appropriate. Today, we can do genetic testing to determine what medication you'd best respond to. It used to be you went to your doc office and they go, oh, you meet the criteria for depression, I want you to try this medication. You come back in a month, oh, I didn't have a response or I had side effects, here, increase the dosage. Today, with a simple swab of your cheek, we can determine which medication you best respond to. It's pretty cool. It's changed how we practice. So medication's not the only treatment for depression. We know that research has showed that the best way to treat depression is to use a combination of medication, if indicated, and therapy. More recently, the studies have shown medication, therapy, and movement. Get your butts up and move. Always are recommending to our patients that they actually go out and move, whether it's walking or anything, chair yoga, whatever you can do will improve your psychological functioning. Extremely effective when you use things in combination. So, what can you do? First of all, evaluate how you deal with things. Take a look at your own coping style. Remember I said problems-focused coping styles is the best way to deal with anything. You can change your perception. What you can do, not what you can't do. And be aware of your what-if thinking. Let me go down here. So I wanted to talk a little bit about what you really can do. Last month I was fortunate enough to be at Johns Hopkins University Medical School, and I attended a lecture by Dr. William Gordon. Dr. Gordon is at NIMH and has worked exclusively with trauma patients. And he talked about what the research shows, what we can do in dealing with trauma. And those 3 skills that he talked about also can affect and have impact on all of us. And the first thing he talked about another symptom of anxiety is your mouth dries. So, excuse me. What he talked about was changing our thinking. And he talked about be here now, being in the present. It was in the late 70s. There was a psychologist named Richard Alpert who actually went out and studied meditation and changed his name to Bamba Ram Das. And he wrote a book called Be Here Now. And if I have one gift to give you all, it's this. When we think about time, time is an abstract concept. Stuart said to me, Rick, I'll see you on Saturday at 11 o'clock. And when he told me that, it was a couple of weeks ago, months ago actually, it was an abstract concept. We've created time to coordinate events. So if you think about that, what really exists in time? Does the past exist? No. The past is a memory. It really doesn't exist. It's not tangible. It's not real. Does the future exist? Absolutely not. The future doesn't exist either. The only thing that really exists is this moment. This actual moment that I'm here with you right now, sharing information, that's all that really exists in time. Now, the most difficult question: do I have any control over the past? No. It's gone. It's happened. There's nothing I can do in this moment to change the past. Now, the most difficult question: do I have any control over the future? I've heard no, yes, some. And they're all correct. No. Excuse me. The truth is, we don't have any control over the future. We can plan. We can have goals. And plans and goals are our subjective reality. They're what I'd like to see happen. And those are important in life. We don't accomplish anything unless we have plans and goals. However, we don't have control of the future. The only thing we have control over in our lives is this very moment. And you might be sitting there and thinking, oh, well, I'm worried about what the stock market has done. I'm worried about my loved one up north. But there's nothing you can do about that right now. The words, what if, are important for you to start to recognize. The words, what if, put us out in the future where we don't have any control and cause us anxiety in the moment. The words, could have, would have, or should have, puts us in the past and causes us guilt or shame over something I don't have any control of. In dealing with a chronic illness, the most common words are what if. The minute you hear those words, you need to realize you're causing yourself anxiety in this very moment And you need to say to yourself, stop, moment to moment. That will give me control. And once you start to deal with life that way, it becomes more manageable. So we all know that recently it's become cool to talk about mindfulness. And I get a chuckle about that because mindfulness has been around as long as I can remember. It wasn't called mindfulness. We have this way of recoining and labeling things. But meditation and mindfulness can be so important and impact not only how our disease is, but how we deal with our disease. And when I talk about meditation, I'm not saying you need to go out and find a guru. You can stay right here in Broward County, and you can even stay in your own house, because all meditation means is calming ourselves down. Just taking a minute to relax, to calm. It can have profound effects on how we cope with the psychological impacts of MS. Edward Jacobson, who founded what we call progressive relaxation, said, "A busy mind cannot live in a relaxed body." So, I'm going to teach you right now a really easy technique for meditation. And we're not going to sit there, we're not going to go, Om, we're not going to cross our legs. What I am going to ask you to do is, if you can, unfold your legs, put both feet on the ground. And just get comfortable. Just be aware. I want you to just be aware of yourself sitting in the chair. Just become aware. Recognize. Feel your butt on the chair. Recognize where you're sitting. Just kind of turn your thoughts inward for a minute. Pay attention to your breathing right now. And I want you to, if you would, just start breathing slowly and deeply. Inhale, if you would, through your nose. Exhale through your mouth. Allow your belly to be soft. Those of you that have done yoga know that we're talking about diaphragmatic breathing. Let your belly be soft. Let it expand. On the in-breath, relax even more as you exhale through your mouth. You can say to yourself, soft as you breathe in, and as you exhale, say belly as you breathe out. Soft belly. This will help you focus your mind and remind you that you want your belly to be soft and relaxed. Inhale through your nose, soft. Exhale through your mouth, belly. Just allow your inhalation to just be soft. Exhale, belly. This is a really concentration meditation because you're concentrating on your breath and the words soft and belly. And on the belly, feeling of your belly rising and falling, softening a little more with each inhalation. If you feel comfortable, just allow your eyes to close right now. Just allow the eyes to close. Inhale, soft. Exhale, belly. Soft belly. If thoughts come to your mind right now, let them go. Gently bring your mind back to the phrase, soft belly, soft belly. And just allow yourself to do this for a minute more. And if you will, allow your eyes to open right now. I chuckle because I wish I had a camera. I'm not going to make you cluck like chickens. So you can do this wherever you are. Take a minute and do this. You have no idea the profound effects this can have. A busy mind can't live in a relaxed body. The last thing Dr. Gordon said was, we need to dance. I invited Bob Marley to join us this morning, and we were going to, how many of y'all remember American Bandstand? Yeah, okay, some of you are of my generation. Remember that they just, everybody danced. So I invited Bob Marley to join us this morning. Unfortunately, I was told, due to copyright restrictions, he couldn't attend. So what I'm going to suggest you do is when you have an opportunity, put on your favorite music. Close your eyes and let the music just come through you. Allow yourself to express whatever that music engenders in you and enjoy it. It is the third thing you can do to help deal with the psychological implications of MS. Be here now, soft belly, and dance like you've never danced before. Thank you.
And now we're going to give Dr. Harris his plaque. Hey!
Hey!
Great, thank you.